Hi, I'm Dr. deGoma. I'm the creator of these two YouTube channels. The purpose of this video is to introduce myself to you. Because they are health related, I think it's important that you know the credential of the person creating and producing their contents. In terms of financial disclosures, I have nothing to disclose. I am not selling any books, health supplement, or dietary products. I'm a practicing MD and have diagnosed and treated many thousands of patients and followed them up carefully for many years and even decades. Some of you may be wondering what the initials after my name stand for. FACC, Fellow American College of Cardiology, FNLA, Fellow National Lipid Association. These titles are awarded after meeting high standards set by each professional organization. I am board certified in 3 specialties: internal medicine, cardiology, and clinical lipidology. For the first 20 years of my clinical practice, I was helping people by diagnosing and treating their heart condition. It was a traditional or conventional approach. The second half of my career started in 2001, and it was not conventional. I decided that diagnosing and treating heart disease, primarily heart attack related, was not enough. I wanted to find a way to prevent as many heart attacks as possible, and that pursuit led me to become a clinical lipidologist or cholesterol specialist, and I am one of among the very few 50 or so in 2006. I created 3 websites: drdegoma.com, which is a small website optimized for smartphones and for telehealth for my patients. The other website is drdegoma.com, which is my regular website. It has a lot more information in it. And the last is cholesterolclinic.com. I am a cholesterol specialist, and cholesterol management plays a key role in improving cardiovascular outcomes and reducing cardiovascular healthcare expenditures. In 2001, a wide treatment gap was uncovered nationwide by the LTAP study. In these patients who were at very high risk for cardiovascular events, meaning heart attack, stroke, sudden vascular death, only 18% were receiving the recommended medical treatment that had been proven to significantly reduce these events. I created Care Innovation to treat most of these patients successfully. This is a topic for another video, but briefly, these are the published results. So in 2006, we had 85% of high-risk patients achieving their treatment goals. It was clear by this time that these patients were already doing better, and it just got better year after year. 10 years later, in 2006, our second published data was even better. 89% reached LDL treatment goal of less than 100, and 51% were less than 70. As far as I know, there is no other published data in the world that is as good as what we have achieved. All that extra work and diligence resulted in a dramatic reductions in cardiovascular events, expensive cardiac interventions, and cardiac hospitalizations over time. By closing the treatment gap, which started in 2006, we also started to turn off the faucet of patients having cardiovascular events. Dr. Kem Williams said exactly just that in 2015 while he was the president of the American College of Cardiology, and he said, "It's time to turn off the faucet instead of just mopping the floor." I'll talk more about that in my next video. Also important is healthcare savings. We saved Medicare over $8,000 per beneficiary with diagnosis of CAD, and over $6,000 per beneficiary with diagnosis of diabetes. I was awarded New Jersey Top Doctor in 2019 and 2020. We created a working best practice model for heart attack and stroke prevention. The same medical treatment that prevents heart attack also prevents stroke. We develop care innovations to successfully treat most high-risk patients to optimal treatment goals that induce plaque stabilization and plaque regression. We have 2 published performance data 10 years apart and have shown improved patient outcomes and also substantial healthcare savings. I'm inviting you to watch these 2 YouTube channels, one about fighting a long-standing and largely forgotten epidemic, and the other channel about fighting the current pandemic. If you find value in these channels, please subscribe and hit the bell icon so you don't miss any of our weekly videos. Thank you.